Hi dear doctors, welcome to the class of Kidscovery. This is a pediatric class by me. I am Dr. Parv and we are going to start with a superb lecture today, that is Ehlers-Danlos Syndrome. So before I teach you Ehlers-Danlos Syndrome, I just want you to focus over here. So she is a chef, okay, and so she is a chef, okay, she is our chef, and he is the chief chef. So this lady is going to cut a rat, okay. So this rat says this is gonna hurt me, okay. So this is gonna hurt me. What you are supposed to remember, that there is a chronic pain which is there. The pain is chronic pain because the wound is not getting healed, so that's why it's chronic. So abnormal wound healing, easy bruising, faulty collagen synthesis. Now, can you see the joints? Joint hypermobility and hyperextension of the skin. There is increased risk of aortic root dilatation and dissecting aortic aneurysm. Can you see this is just like a root of aorta? So this is just like a root of aorta. So you can remember there is increased risk of aortic root dilatation and dissecting aortic aneurysm. So aortic root dilatation, aortic aneurysm, dissecting aorta, all these things can happen. And of course, there is a postural orthostatic hypotension and tachycardia syndrome. So there is postural orthostatic hypotension, and of course that causes what? Tachycardia. So the point is, like, why all of these things are happening? So please understand that the Ehlers-Danlos syndrome is nothing but a connective tissue disorder. It's nothing but what? It's a connective tissue disorder. Let us just understand one by one. So basically, Ehlers-Danlos syndrome is a connective tissue disorder which is going to affect the skin. So as you have seen that there will be loose fold of the skin. There will be ligaments that will be having less power. That's why there is a hypermobility at the joints. Blood vessels will be hampered. So there is aortic aneurysm, dissection of aorta, and in fact the aortic regurgitation that is going to happen, okay. Now Ehlers-Danlos syndrome, so Danlos, D and A coming together, you can remember with the help of D and A and D, that is autosomal dominant. Then what is the problem? See, the problem is in all the types of collagen fibers, in all the type. So basically you have got type 1 and type 3 collagen which are mostly affected. The gene is called 5A1 and call 5A1 is something that is going to affect type 1 and type 2 because it's A1, so it's going to affect type 1 and type 2, whereas call 5A2 is going to affect the type 5 collagen, and this is the classical type. And if this class call 3, that's type 3, this is actually the vascular type. So how to remember this? Call 3 is vascular type. Remember there are 3 types of vessels. Arteries are going to be there, veins are going to be there, capillaries are going to be there. So you can easily remember that type 3 or call 3A1 is going to affect the vessels. And type 4, I have already told you, type 4 is again, okay, now I have not discussed. Type 4 is also a vascular type, which is in fact along with the arterial involvement, it can also involve the bowel, it can also involve the uterus, because 4 is generally related to the smooth muscle, okay. 4 is something which is related to the smooth muscle. So how to remember? So 4 is very similar to more. So more, M for more, M for muscle, M for more, M for muscle. Coming on to musculoskeletal findings, so can you just see, this is the typical spine which is there, but since the joints are hyperextensible, so here the joints are going to be like how? These joints are going to be having scoliosis. Of course, there will be hyperextensible joints which are going to be there. And so what are the dermatological findings? So there will be palpable nodules, and of course there will be frequent bruising. Palpable nodules are going to be there. I think this is not visible in this picture, but 1 or 2 might be visible. Palpable nodules will be there. And cardiovascular findings, I have told you that the aortic root dilatation is going to be there, the vessels are prone to rupture, there is going to be mitral valve prolapse which can occur. GI findings, like of course the gut is going to bleed like anything because the vascular collagen fibers are also not good. So vascular collagen is also not good, so there is less strength which is going to be there in the vessel, so there will be gut bleeding, there will be rectal ulcers which are going to be there. Now skin fragility can be there and joint hypermobility can be there, but that is why the Ehlers-Danlos syndrome and Marfan syndrome are very much similar. Of course, I'm going to teach you what is the difference between the Ehlers-Danlos syndrome and the Marfan syndrome just now, but as of now just remember they are the differential diagnosis of each other. How will you diagnose? Of course, clinical diagnosis is going to be there, which is supported by the genetic testing. No definitive cure or is there, you have to just do the symptomatic care, symptomatic treatment. So can you see, this is something which can be seen in all the connective tissue disorders. So in all the connective tissue disorders, so generally it's not possible that the first finger is going to cover you and you can hold it like in the close proximity. But since this is Marfan syndrome, and in case of even Ehlers-Danlos, the positive wrist sign is there. Why? Because the thumb and little finger can easily overlap. Okay. So in Marfan's also there is MVP, there is necrosis of aorta, aortic regurgitation, fibrillar defect, FBN1, aortic aneurysm. So the major way to differentiate between the Ehlers-Danlos and Marfan's is actually the gene which is responsible. So we have already discussed that call gene, like call A5, okay, call A5. Yes, I have discussed, right? Yeah, call 5A1. Okay, call 5A1 is the gene which is mostly involved in the Ehlers-Danlos syndrome, whereas it is the FBN gene which is involved in the Marfan's syndrome. And also Marfan syndrome is associated with the ocular findings also, which are not seen in the Ehlers-Danlos syndrome. So this is just a thing you have to keep it in mind. So thank you so much for watching and God bless you. We'll see you in the next video.